Okay, so good evening, everyone, and welcome to this session on Let's Talk Mental Health by Samvedna Senior Care. I'm Archana Sharma. I'm the founder of Samvedna, and today we have a very distinguished audience. I have with me Dr. Vipul Rastogi. He's one of our panel of experts at Samvedna, and he's been a guiding light for the last many years. So Dr. Rastogi is a consultant in behavioral neurology and psychiatry. He is also a consultant at Medanta Hospital. And after completing his training in psychiatry from the UK, he has worked as a consultant with the NHS. And he's one of the very few psychiatrists in India who has a formal training in neurology and has completed MSc in clinical neurology from Queen Square, London, which is one of the foremost institutions of neurology in the world. And Dr. Rastogi has also done his PG diploma in neuropsychiatry from the University of Birmingham, UK, and diploma in clinical psychiatry from Ireland. So Dr. Rastogi's specialization is traumatic brain injuries, neuropsychiatry, dementia, Parkinson's, and multiple sclerosis. So Dr. Rastogi, Dr. Vipul, welcome, heartiest welcome to our panel today, and we are really happy to have you here. I also have my co-founder, Dr. Jayashree Das Gupta. She's a neuropsychologist from NIMHANS. She's our project director. She oversees all our cases at Samvedna. So over to you, Jayashree, to introduce Dr. Vipul and the talk.
Thank you, Archana, and very warm welcome, and thank you for joining us, Dr. Vipul. Clearly, this has been a very trying period. We've crossed the, officially now we're well into 1 year since the pandemic began, and people have been facing all sorts of difficulties and challenges. What are the kind of challenges that people have been coming to you with, and how have you seen this pandemic impact mental health of individuals?
Yeah, so first of all, good evening to everybody who's joined in, and thank you for having me there, Rachna ji, Jayashree. So we've been planning to do this for a while. Today we are actually finally doing it, so I'm quite happy about it. Jayashree, as you rightly said, I mean, if I look at my life a year ago, it's very, very different to what it is now. And I feel, the pandemic has touched each and every one of us, right? So we can only talk about how much it has impacted a person. We are not talking about whether a person is impacted or not. So we've all been impacted, less, more, but everybody, universally, everybody has been affected. People are coming up with different challenges, whether, it's the uncertainty towards work, job, money. If I look at, a lot of people that I see, the salaries have been cut, although the expenses haven't gone down, but the salaries have got cut. They don't have much of a say. And a person struggles more when they feel that there is nothing that they can actually do about the circumstances. So otherwise, if somebody is struggling with money, if it's normal time, they can think and work extra, work harder, or do some more part-time work, or do something on the side. But it's such times where we can't do very much, and we are all cooped up at home. Me and you are possibly lucky; we can go out and see a few people, but otherwise, people have been pretty much locked in. So uncertainty around work, definitely, which is there. Uncertainty towards your own health, parents, a lot of people. I mean, I'm guessing most of the people who joined us are from Delhi NCR, and their families might be back home. Right? So they might be somewhere else, smaller cities, B towns, C towns, and they were all left alone initially because there was nobody there. They were left without any help, and people just managed it by themselves. So different sorts of challenges. Children being at home. Children have a lot of energy and they're unable to expand it at the present moment. And that comes across as irritability in children, or argumentative, that sort of a thing. Children are not achieving what parents want them to achieve. The teachers are struggling. We unfortunately see a disproportionate number of teachers who come to us because their complete style of teaching has changed. So, and of course, people, normally, we talk about people having 2-bedroom houses, 3-bedroom houses, or, flats, and, howsoever people live. Now you have 3 or 4 people who need their own space in the same 2 rooms or 3 rooms, because everybody has to, somebody's working from home, somebody has school, lectures, tuitions, so, and people may not have enough, smartphone or smart gadgets to do it. But even if they have, then they don't have the space to accommodate all of that. And so these are for, difficulties for working people. Now, if I look at people who are homemakers, it doesn't matter, men, women, but people who are homemakers, they would get a little bit of me time during the day when the children were out, the husband or the rest of the family has gone out to work. But now they're inside. Their work has actually gone up disproportionately, right? So everybody else still gets a bit of a break. But people who are homemakers now, there, of course, a lot of people that are joining us might be carers as well. So their work has gone up exponentially. No personal space. So that sort of a thing. Somebody has written a question about domestic violence and abusive relationships. Now we all know when 2 people are locked in, they will have more arguments. I can't condone domestic violence, but it's obviously it's awful. It should not happen, ever happen. But people will have more arguments when people are stuck together, cooped up, and this has gone up unnecessary. No, not unnecessarily, but it has gone up for too long, unexpectedly. So when we started with the lockdown, I think the first time I heard about pandemic was towards the end of December. Something is happening in China, which we've heard lot of times. And then around February, I think the first case came in Delhi, one of the Delhi schools, and then the lockdown happened, of course, towards middle end of March. So, and then it was 6 weeks, then another 4 weeks, and another 4 weeks, and then okay, unlock 1, unlock 2. So this has just been going on for too long. And if I look at people that you normally see, so the elderly population, जो आप लोग देखते हैं, so they also don't have their personal space anymore. So one, they don't have personal space because their rooms have been or are being utilized to support the rest of the family. So they don't have their personal space. Second, the mental stimulation has gone down drastically. They can't go out, they can't meet, they can't walk. More danger, of that infection affecting them badly. So I mean, whatever age group you look, whatever sex you look, everybody has struggled badly, and people are coming with depressive, more panic, health anxiety, sleeplessness, a big issue at the present moment, because the mind is not getting relaxed and the body is not getting tired, right? So for a good sleep, the body needs to be tired and the mind needs to be relaxed, but that is not happening because it has just turned around. So these days, because we're not doing very much, so the body is relaxed, but the mind is tired because there's just so many things going on. So sleep difficulties, anxiety, depression. So those are the things that we are seeing very commonly.
Right, absolutely. And as you mentioned, this is something that's impacted all age groups, and right from children to adults, older adults, whether you're working, whether you're a homemaker, it's impacted everybody. And as you mentioned, it's not. It's really about how much it's impacted us all.
Yeah,
Um,
absolutely.
One of the things that we get asked a lot by people is really, when should we seek help? And just before I request Dr. Vipul to respond, I'd just like to mention to everyone who's listening in, please do type your questions in the chat window. This is being recorded and will be shared on our social media channels. So you can either type in the chat window, or you can send a chat message to us with your question privately as well, and we will address, put it out anonymously to the doctor to respond. So do share your questions. But just getting back to some of the questions that we've already got in the chat. One of our the people listening in is saying that they're experiencing suicidal tendencies every day.
Yeah.
What should they do?
See, one, I think we have to acknowledge that these are tough times, and even if people do not have any mental illnesses, people will go through. So the research says about 5 to 6% people will have some suicidal thoughts throughout the year or through a year. These are people with no mental health issues, but people have a thought, but they don't do anything about it. So it comes and it goes. But of course, these are stressful times. So people are having this feeling, when will this get over? Why only me? Why is it happening in our life? When will it get over? So those kinds of questions are coming in, and compound it with the real life difficulties that people are facing. So they feel out of control, and that may seem like the way out. But look, if you're really, really struggling, then you have to seek help. I can't comment on individual cases, but if you're really struggling, please do seek help. You're reaching out to us and talking about it. I think you're well aware of what you're going through. So do reach out, whether it's a psychologist, psychiatrist, it doesn't matter, or even your physician, because there's a lot of evidence to suggest talking with someone helps, right? It breaks the cycle. And if you feel a bit of reluctance to go to a psychologist, psychiatrist, at least meet your physician and they can guide you in the right direction. But look, I mean, these are challenging times, but hopefully we're coming to the end of these challenging times, maybe 2 months, 3 months, 4 months, whatever it is. But it seems like this at least this portion will be over, and then we can all start building up our lives again. But I mean, to our listener, I would really say, please seek help.
Absolutely. And as you mentioned, to anyone you're comfortable with, but definitely do seek help. If it's something that I mean, a lot of people have also reached out saying that they've been suffering from OCD or bipolar disorder, depression for a couple of years now, and they've experienced a worsening in their symptoms. Does that mean they should immediately reach out for help, change their doctor? What should they do? People are very confused about this, because they know they're unwell and they're on.
Yeah. So it is, I mean, clearly, I mean, it is affecting people more. So people who have had issues before, they will get affected more. And if I just give you a little general how I see things work, right? So I would normally suggest people to look at their life like a weighing balance. So look at it like a tarazu. On one end of the scale, put everything that you find difficult or challenges in your life. So you put it on one end. The other end of the tarazu should have something to compensate for that. So if you're putting stress on one end, then the relaxation should be on the other side. And both have to be in equal proportion to keep your life in balance. Now, unfortunately, if I just talk about pandemic, what has happened is the stressors have gone up significantly. And the good things that we did have reduced quite a lot. I mean, they've essentially disappeared. So this has really become very much skewed. And that is why people are struggling more. Now, if we speak logically, to feel better, we have to bring it back to shape. And if you can imagine any tarazu, there are only two ways to get it right. One, you reduce the stress, or you increase the relaxation that you undertake. So, and as we were talking before, a lot of these stressors are not in our control. So if we can't focus on stressors, then we have to focus on the relaxation side of it. So, and the treatment for, whether we talk about bipolar or OCD or, dementia as well, we don't only focus on medication. Of course, medication helps, but if you can supplement it with some, nice hobbies, activities, yoga, gym, running, whatever you can supplement it with, your medicines will be doubly or triply more effective than just taking a pill. Most of the doctors are doing online consultations now. And if you feel you can't reach your doctor or they're not available, then of course seek somebody else. But as doctors also, I mean, we've also learned on the job in a way that with the pandemic, how to support people better. So if you're not feeling well, reach out to your own doctor. But if you can't, then of course, you can change your doctor as well.
So I think really the bottom line is seek help. And don't give up. If you find something isn't working for you, don't stop with that. Continue to seek help from another doctor or a professional, and stick with the help and the advice.
Stick with the help. Stick with the help. And sometimes what happens is people might tell me that, look, okay, yoga works, right, or meditation helps, but it doesn't mean that it will work for me. So choose something that works for you, right? So if let's say somebody, and I'm not being ageist here, but let's say I see a 15-year-old and I say to them, okay, look, you do chanting every day or you do mantra jap every day, it's not going to work for them. Or if I'm seeing a 70 or 80-year-old, I tell them, look, you should be doing a breakdance every day, it's not going to work. So we have to find the right things that work for them. So they should be able to enjoy it. It's not a homework. It should have a fun feeling, fun factor to it, and then only it is successful. And it can be anything, because it is just like stress is very, very subjective and personal. So is the relaxation activities. So do something for yourself every day. That feeling that yes, I've done something positive for myself today is essential.
And this actually, I think, is also related to another question that we have around how do we overcome the feeling of hopelessness? I mean, this has been going on for so long now. I know a lot of people have been reaching out to us saying that they're just feeling so hopeless and that there isn't really an end to this in sight.
Yeah. But I mean, look, when we feel hopeless, then everything looks very black, right? But the honest answer is it's gray. It can't be white. It is gray, and we're moving from black to white these days, right? So from darkness, we're going towards the light a little bit. So things will get better over the course of next few months. That is what is expected. That is what people are also people where vaccinations have started. So we have to hold on to that small hope that it is going to change. And once people start stepping out, the economy will also open. I suspect the jobs will be there as well, and financially people will do better. But hopelessness is not a good sign, and we all go through phases of that. But if it is a sustained phase, and you're struggling with, so somebody said, what are the warning signs? So hopelessness is one warning sign. And if you add sleeplessness, irritation, low mood, crying spells of anxiety, right, then those are all signs that people are struggling. Now, if I may add, so people talk about depression, right? So depression actually has a different medical meaning compared to what we use in common language. So I might say that, look, I feel depressed today. It doesn't mean I'm clinically depressed. So for a clinical depression, the definition is that we should be feeling bad or sad or low in mood for at least 2 weeks. So it's not today, tomorrow. It should be at least 2 weeks, and it should be in all wakes and forms of life. So it can't be that I feel depressed at home and I feel happy with friends. That is not depression. So depression has to be sustained for 2 weeks, and also the same sort of feeling should be there in personal life, professional life, social life. Then only we call it a clinical depression. But otherwise, we all go through, we all go through our variation of mood on a daily basis. We're all, I like to say, we're all nice human beings. So if something bad is happening to other people, or something bad is happening in the world, we will get affected by it, right? But it should not be sustained. If it is sustained, then it is a problem.
Thank you. And I think that's really highlighting a difference between when you need to become very concerned about reaching out to seek help. So if you are experiencing low mood that's continuous for a long period of time, medically it's defined as 2 weeks, and this is across your personal life, your professional life, irrespective of what you're doing, this mood isn't improving. That's really a major indicator to reach out for help to a professional. We have another question about how do you convince someone who doesn't believe that depression and anxiety are real conditions? How do you convince them to seek help?
Okay. So look, people have a lot of, there's a lot of stigma, whether we like it or not. There is still a lot of stigma. It is a lot better than what it was, say, 10 years ago, and significantly better than 40, 50 years ago. I work in an area, right? So I work in Gurgaon. I have some work in Delhi as well. So where people have much better awareness, right? So people who come to see me are those who are not reluctant, and they are seeking help by themselves. There's only very few percentage who might say that, look, my family has brought me here, I don't want to be here. But generally speaking, the awareness is lot better. What I normally tell people is that rather than using the words as depression, anxiety, we have to look at a person's functioning levels, because that is the best indicator of how good or bad things are for you. A lot of times, if you're not, we may not be that unwell, so which means our functioning is absolutely fine. We may not be the happiest person around, but our functioning is fine. Then we can observe and watch, right? But if the functioning is coming down, and depending on the impact on your functioning, then you judge the severity of the problem. And that is what I will tell to people. So if it's a young boy, or a 20-year-old man who's come to see me, who's just sitting at home, I would normally tell them that, look, what would a normal, not a normal, a standard 20-year-old will be doing. So whether they'll be studying, they'll be in a job, business kar rahe hoge, ya prepare kar rahe hoge exam ke liye, and what else is there, right? And if you're not doing any of these, then your functioning levels are actually poor. And we have to try and use whatever strategy we have to improve your functioning levels. So I would normally use functioning levels rather than the terms depression, anxiety, or psychiatry or mental health still have a lot of stigma attached to them.
Yeah, and I think that's really a wonderful advice and something to keep in mind, that if you feel that your functioning has changed and you're not able to function like you were previously, or you've noticed this kind of a change in some family members or loved ones around you, your friends or someone, and you see that that change is actually persisting over a period of time, then it's probably a good time to have a talk with them, initiate that discussion about seeking help from a professional. We have a number of questions, and I just wanted to, ask another one that's come up. The question is that there are times when we see our elderly struggling with mental health issues, and it becomes important to seek psychiatric or psychological support, but it becomes very difficult to convince them. What would you suggest the family could do in such a situation?
Okay, so first thoughts. So there's more stigma in the elderly people compared to the younger ones who are much more able to accept it. Second, even a single consultation helps. And rather than going with that idea that, look, something will be done today, sometimes as professionals, we just want to develop a decent rapport with the person, with the patient. That look, let's just talk about it without any expectation of treatment, because people have more stigma about medicines also. They're okay to talk because elderly population, people in elderly population feel a lot of loneliness, so they want to talk, but they just don't want to take medicines also, and that's okay. So a couple of sessions to in developing rapport help. But when we try and do everything in one go, because the person may not come the next time, then I think we lose out. I don't think we are able to sustain those consultations or their appointments. The other thing is, it doesn't have to start with a psychiatrist. It could just start with a physician. And when the physician or a cardiologist or whoever you see, if they say that, look, I think you should meet a psychiatrist, then the acceptance is much better, right? So rather than the family saying, hey, I think you should see a psychiatrist, if it is another doctor, another fellow professional who says that, look, I think in my professional opinion, you should see a psychiatrist or a psychologist, people are much more open with that idea.
Yeah, so maybe that's something which family members could do, is discuss with the physician, perhaps someone whom the elderly may have already been in contact with, trust a bit more for a longer period of time, share their concerns. So I think that's a really a very important thing that family members could do, which you've highlighted. And that's a great step that they could take towards initiating help for an elderly person who's probably a little reluctant, because yes, stigma is a major challenge. And in fact, I think recently the longitudinal aging study in India, results from this were released, and it suggested that there are 20% of elderly who actually have mental illness. And this is a very large number. So I think it's something, I mean, would you like to comment on that? What should we do to create more awareness about this?
Yeah, so look, I mean, it's a huge number, and considering our population, it becomes huge. Now, what people don't understand is that people feel mental illness is just one, right? There's not one mental illness. There are more than 100 different diagnoses, and people may be going through memory loss, or they may go through anxiety, they may be going through depression, or it could be, sometimes people. What happens is when as people age, the hearing goes down, and when you can't hear very properly, then you can't understand, then people are more irritable, or they may hear some strange noises and voices coming through. So there are numerous diagnoses. I think the problem that we all, what has happened in popular culture, so I mean television and cinema, it is shown as one, right? So unfortunately they use the word pagal, which means nothing, but that is where the stigma comes from. So there's a huge number, and because people do not, one, there is ignorance, right? People don't realize it. So first is that, and second is that, if I go, then, they'll be put on medicines for life. I'll be drowsy and I'll be like a zombie. So those things are actually very big misconceptions because one, as I said to you, not everybody is going to need medicines. Second, we have moved on from 1960s to now we are in 2021. So medicines are much more safer. People, yes, of course, some medicines have sleep. A lot of medicines do not have any sleep. They're actually alerting. So times have changed, medications have changed, and I would suggest, going with an open mind is the best thing you can do. When you go to a doctor and look, you're a consultant neuropsychologist, I'm a consultant neuropsychiatrist. We are consultants, right? So we give opinion, we give advice, right? You're not forced to do it, right? It will be nice from our point of view if you do it, but I'm suggesting just go and take advice. Just, you still make up your own mind what you think about it, but don't just suffer in silence. Just go and discuss it. And a lot of times, even, you would realize when people have dementia, memory impairment, a lot of times it is reversible, right? And the sooner you reverse it, the better it is. So unless you reach out, people are not going to be able to help you. So rather than having that negativity in mind, I think just go with an open mind. Let's just go and talk today and we'll see what happens.
Absolutely. And I think that's really, really important to kind of spread that message also, that if you see somebody is having some sort of difficulty, if you're noticing a change in functioning from what they used to do previously, particularly in the elderly, if you're noticing that change in forgetfulness, loss of memory, it doesn't necessarily mean it is dementia. It's important to rule out even reversible causes. And for that, it's really critical to seek help as early as possible, rather than push it off or just say that maybe things will just get a bit better with time. Because I think that's something that we hear a lot of people also saying about even mood-related problems. But yeah, seek help. And I mean, I completely agree with Dr. Rastogi that these are opinions which we're offering. If you don't like the opinion, discuss it. I think that's something which we don't get people coming back and saying, this is a problem with the medication, or this is the problem with what you said, and I couldn't do this, but I could do this. We want to hear that kind of discussion. We want to hear that kind of feedback from you as well. So there's, Archana, I just wanted to check if there's some questions from our viewers listening on Facebook.
Not yet, Jayashree. Not yet.
So do type in your questions. Do share. If you would like to ask anything about concerns that you have about other friends or families, then do type them into the chat box, and we can address these questions to Dr. Rastogi. Another question that we often get from a lot of people is, particularly with relation to the elderly, is that they're reluctant to to go to the hospital, meet someone, or that they're reluctant to even come for an online consultation. So family members often say, can we come and meet you, tell you what the problem is, and is that okay? Is that a suggested first step?
I think what we get from seeing a patient cannot be replicated by just listening or hearing about it, right? So, I mean, we have to talk about something is better than nothing sort of a concept, but it is always better to see the person because, as you know, as we're talking about, there are reversible causes of so many illnesses and diseases. So let's say, I mean, you and I see a lot of Parkinson-related dementia, right, or Parkinson-related issues. And if just the care or the family member comes and tells me, okay, look, the memory is not great, I can do something about the memory, but if I don't see the hand shaking, I can't do anything about the Parkinson's. And treating Parkinson's is as important as treating the memory issue. So it is better than nothing, but it will be good to see the patient in person. And these days, with people embracing technology because of COVID, right? So whether it's a WhatsApp video call or we're doing a Zoom call today here, so it is okay to see people through camera. That's okay, right? So, but that one-to-one is always the gold standard. But if it is not possible, then yes, a video will do fine. And as you have more confidence in your consultant, in your doctor, and equally as the doctor is more comfortable with your diagnosis, then it is okay to do it. Whether we do it, somebody comes and tells us, okay, so this is happening, or a telephonic one. But initially, we can do a visual one. I think that helps a lot.
So somehow it's really important to encourage the person to at least do an online consultation in the present times.
Yes,
If
absolutely.
they're not willing to visit
Yeah, yeah,
a doctor.
yeah.
Right. We have another question about how do you create positivity in your oneself during these times?
Yeah. Okay, we have to find it. We have to discover it, right? So we have to find whatever works for you. So I saw somebody today, and a young person, working professional, but a freelancer. So the work is less, and I was suggesting. I said, why don't you learn a new language? Right? She said, well, I have got enough on my plate already. But I said, work is work. Work is not relaxation. Work will not bring you positivity. I mean, we all love our work, but we can't do it 20 hours a day. So it's those kinds of things. So you may love a dance form, you may love art, you may love, as I said, learning a new language. So we have to find that extra little thing for ourselves, what works for us. As I said earlier, one size does not fit all. So if something works for other people, it may not be the best thing for you. So, and another thing that I notice is people want to do something big, right? Now it is always about baby steps. It's about small changes, right? You take 5 minutes out, you take 10 minutes out. Don't wait to take out 1 hour. Okay, if I have 1 hour, then only I will do it. I don't think that works. So if you have 5 minutes for yourself, do something in 5 minutes. If you have 10, you do 10. Because the idea is if you start doing five and if you like it, then you will automatically increase it to 10. But if you keep waiting for that 1 hour, you're not going to get it.
Right, absolutely. So start with small steps and identify something that works for you. So
Yeah,
if something doesn't work for you, try something else.
yeah.
But as Dr. Rastogi mentioned, really look for that positivity within you. It's something that you'll have to try and search for. We have another question about caregivers who are experiencing a lot of difficulties, particularly
Mhm.
during this time. What is
Yeah.
your special advice to caregivers of,
Okay,
people with
so
mental illness?
okay, so I have a lot of respect for caregivers because I think it is a tremendous job and it is a difficult job. And funnily enough, I was reading a quote and I should have remembered who said it. So they said there are four kinds of people in the world, right? One people who are a caregiver now, two who have been a caregiver, three who will be a caregiver, and four people who will need care or who will need a caregiver. So everything revolves around caregivers, and unfortunately, and uh, in a way, and I'm guessing most of the people here are people who care for dementia uh, patients. In a way, a lot of time it feels like it's a thankless job because you keep on doing it, you keep on doing it. You don't get the benefits out because you don't see those positive changes or marked changes in a person. You're happy just to have an okay day, right? It is difficult to have great days, and with the realization that it is a progressive illness, and due course of time it goes down. So a lot of respect, but as I was talking about that when we started, we were talking about that tarazu analogy. So you have to manage your stressors with equal amount of relaxation on the other side. Unless you look after yourself, you can't look after anybody else. So do make time for yourself. It's not a crime. It's not something to feel guilty about. But unless you look after yourself, you honestly can't help anybody else.
Absolutely. I think that that's really important. Caring for yourself whilst you're providing care for someone else is very important. Something that I think all caregivers really need to keep in mind. It is difficult. I think that's the one thing that often gets missed out. So thank you so much, Doctor, for really highlighting that. That's really, really important. Uh, we have another question from one of our listeners who's saying that their 68-year-old wife repeats words while speaking and becomes scared very easily. Um, what could this be? What should they do?
Um, Yes, I don't think it's enough to give him a clear diagnosis because it could be part of a lot of different illnesses. Of course, when we talk about memory impairment, then yes, repetition of word does mean something. Getting scared easily means something else. So I mean, it is very hard because if you get scared easily, that could be anxiety, it could be paranoia. It could obviously be part of somebody who's got a dementia process starting. So I don't want to scare anybody, but it's hard. I mean, it's impossible to give an answer on that. All I would say is talk to somebody personally and let them discuss more, because there might be other medical issues happening with it which will clarify the diagnosis. But it does need to be looked at. Let me say that.
Absolutely. And I think, again, if there are any concerns that people have about changes within themselves or those around them that they're concerned about, as doctor's been mentioning, it's really important to go and seek a consultation with a professional. Discuss the concerns that you have, because that's when that professional will be able to give you the right kind of advice. Again, doctor mentioned earlier that if it's not, even if it's a physician, general physician or cardiologist, someone whom you're more comfortable with, and you have these concerns, they may be able to guide you as to whom else to seek for the right kind of help. So definitely, I think one thing that we also keep highlighting is if you have a concern, reach out to a professional and seek help. We have well, a couple of questions, and can I request you, Archana, to put these to Dr. Rastogi?
Yeah. So one of the questions is that she has an 18-year-old daughter preparing for JEE, and she feels frequently low mood, irritation, lack of confidence, and as a mother, she's afraid of how she should help her. Any advice?
So unfortunately, I mean, this is a very common experience that people go through, because when people are preparing for any competitive examinations, it is not just about how people put too much pressure on themselves. And what I normally say is it's a little bit of a management concept, where you put where you compare efficiency with efforts put, right? So it's an effort and efficacy graph. So unfortunately, people feel that the more efforts I put, my efficiency will be more, but actually it doesn't work like that. When you try for things too hard, the efficiency actually goes down. It doesn't increase. It actually goes down, because then you're more worried about the result rather than the actual work. So her daughter is clearly struggling, and the suicidal thoughts too are concerning. Again, I would say, as parents, you can be supportive, and the point to make is, as long as you feel that you have done your best, there's nothing more you can do about it, because your result, you're clearing the exam, is not dependent just on your efforts. It is dependent on what happens to other people, or how they have done it. So there's a lot of luck involved. Let me give an example. Let's say, for example, I think the medical exams these days, it's a 700 marks paper now. That's how people are scored, I think 700. And there are more than 1 lakh people who give that exam. But come to think of it, at every marks, there'll be at least 500, 600,000 people at each marks, right? So let's say 600, there'll be 20,000 people who scored 600. But the examination committees have to find a way to still categorize it. So this one is 11,001, this is 11,002, 11,003. And what normally happens is some questions are given more weightage, some questions are given less weightage. And as it was in the news, there were two people who scored the highest. The person who was older got a higher rank, and the person who was a bit younger got the second rank. So there is so much of luck involved here that you can't be too harsh on yourself. So the best you can do is you work the best you can, right? And then you have to leave something for the luck as well. Now, clearly, I mean, this person's daughter is really struggling. And again, I would say, meet a psychologist, give her a 1 or 2 sessions. I think that would also be sufficient. And if the psychologist feels that she needs to come and seek medical opinion, then of course, then meet a psychiatrist. But I think start with a psychologist.
Great. I think we have two more questions. One is, what is the difference between a psychiatrist, a psychologist, and a neuropsychologist, a neuropsychiatrist?
Do you want to have a go at it, Jayashree? So look, so psychiatrist, there's a lot of overlap in work. So that we have to say there's a lot of overlap in the work. Psychiatrists come through a different route. So psychiatrists are trained medically, so they will do their MBBS, and just like people might may choose to be an ophthalmologist, eye specialist, or an ENT specialist, or a physician. So psychiatrists will choose to take mental health as their specialty. Once they so just like somebody has done medicine and they may choose to be a cardiologist, gastroenterologist, in a similar manner, a psychiatrist can choose to be a neuropsychiatrist or a child and adolescent psychiatrist or an old age psychiatrist. So neuropsychiatrist is a super specialization in this field. Now, psychologists come through a little different route. So they may come through a counseling background, and they'll do their MPhil, and most of the people have done PhD, just like yourself. So they come through a little different route, and their expertise is more towards therapy, counseling, assessment, and a psychiatrist will be allowed to write medicines. Right, both of them usually work in conjunction with each other, and the confusion is because there's a lot of overlap in our work. So
absolutely. And but I think the important thing to again remember for people who are listening in is that since we work as a very close-knit team, we work together very closely as colleagues, that if you have concerns about any changes in your behavior or functioning, seek help from anyone. If if you seek help from a psychologist and they feel there's a requirement for medication, we would put, psychologists will usually put you in touch with a psychiatrist, or and vice versa. So I mean, I think that's one thing that might be helpful for people who are listening in as well. But thank you for addressing that. And another question that we have is about what is the ideal balance between medication and counseling? Is one better than the other? What should people, what do you have to comment about that?
So look, let me just take you back to, so if we were meeting in Europe, for example, so India is very different and America is very different. But if I just talking about Europe, people who have mild symptoms, right? So mild, when I say mild, it means that their functioning is impacted mildly, mild to moderate. So they would first actually be referred to a psychologist, right? So they usually have a government setup. It's a so people have to go through their GPs, and the GPs refer them to psychologists to begin with. If psychology does not help, then people go towards a psychiatrist. So that is how the system works. If it's a moderate or severe, then of course they will be sent to a psychiatrist straight away. Lot of illnesses, so some anxieties, somebody mentioned OCD, they have a equal, evidence says equal benefits from psychotherapy or medication. People who are reaching into that moderate severe category, then of course, then we combine actually both the disciplines, so medicines as well as psychology together. So again, if it's mild symptoms, mild, moderate, then you may start with a psychologist. But if your functioning is severely hampered, then you can do with a psychiatrist to begin with. But again, psychologist will anyway still become a part of your treatment plan.
Great. I'm aware that doctor has to leave so I mean, I think there's just one last question about how do we conceptualize good mental health after we've undergone so many uncertainties?
So there is no definition of good mental health, right? Because I normally say use the word normal, but there is no definition of normal in life, right? There is nothing called normal, and people tell me, okay, what is normal? What is abnormal? And I tell to them, look, we can't define normal, so I can't define abnormal also. So we have certain constructs in our culture, in our society, and they change with who we are, where we are, right? So definition of normal is not there, or I can't give you a definition of normal. uh, what we would want is we want to be content. I think content is the word. If you're content with how things are in your life, you have energy to do your work, but also to be able to enjoy the whatever time of the day is remaining with your family. And stressors will come, and what I would normally say is stress is clearly part and parcel of life. We can't avoid stressors. Stressors just change. So if we all reflect on our lives, 5 years ago there was different stressors, now it is different stress, and in 5 years down the line there might be something else. So we all just manage our stressors, right? We can't avoid them. Some people are just a little better at managing it. So if you're managing your stressors and you feel content with life, then yes, it's a good mental health.
And is exercise important?
Exercise is essential, right? So as I said to you, that management of stress has exercise, 30 to 60 minutes of doing something for yourself every day, where you can say to yourself, I've done something for myself today. So that
Right.
feeling is important.
And I think with that, on that positive note, and with that one very concrete step of, I mean, I think exercise is really something important. It's one of the, exercise, relaxation, taking time out for yourself. These are small things that we need to do to take care of our own mental health. And I think that's something which we all need to focus on a bit more.
Yeah. And I'll say one more thing, Jayashree. So when I say exercise, I put, yoga, sports, running, gym, dance, everything into that same category, right? So do what works for you. It doesn't have to be that, people are doing weights every day. No, I don't mean that. Any sort of physical activity is good.
Great. So thank you so much for that, addressing all these questions. And it's been really wonderful to have you. Um, you've touched upon right from what, how important it is to seek help, how important it is to meet a professional, to the various things that one can do to take care of themselves, improve their mental health. Um, and you've really highlighted this in a way that I think been very useful and helpful for the people who've tuned in. I see there's one more question about mental exercise. I think that's also really important as well.
I mean, I think we can't differentiate between physical and mental, right? So I mean, it's the same. It's a body. So any physical exercise is actually a mental exercise as well. It becomes a bit different if you're looking towards people who have dementia or memory impairment, because then we start talking about mental exercises to boost the memory. And I would say for them, I think debating and discussing is the best exercise you can do, because that keeps it keeps the mind running. Apart from that, as you clearly know, doing Sudoku, word puzzles, even Ludo, Carom, right? All those are mental exercises, because you still have to make a strategy when you're playing these games. So all those will be part of mental exercise.
Right. So thank you for being with us today, Doctor. This has been really wonderful. We've had, I think you've touched upon a number of areas. And really highlighted the importance of, when you seek help, if your functioning is something that's changed across a period of time, it's consistently been different from before in your personal, professional life, you're struggling. These are times to really reach out to a professional, and seek help. Um, Go to anyone who can guide you. Don't think that don't. There is a lot of stigma, but take that
Yes.
first step. I think that's the really important message that we would like to share with people listening in. That if you have a concern, take the important step of seeking help. So thank you very much, Dr. Rastogi, for your time, and thank you for addressing questions for our viewers today. And thank you so much for all those who are listening in. Archana.
Thank you, Dr. Vipul. Thank you so much for joining in, and I hope people will take your advice, and they will will at least do basic physical exercise to keep good mental health. That's the starting point.
That's the starting point, yes.
And I hope people are encouraged to seek help for mental health. I think that's one of the stigmas in our society, that people do not come forward with it. So as a part of these talks, we are trying to create awareness about these issues so that people have that habit of inculcate that habit of seeking and reaching out to professionals. So thank you so much, sir, for coming.
Thank you so much, Ashna. Thank you, Jayashree.
Hello.
Thank you, everybody. Thank you.
Thank you, sir. Thank you. Thank you all. Thank you for joining.